Welcome to our video on managing post-traumatic stress disorder, PTSD. PTSD is a serious mental health condition that affects millions of individuals worldwide. In this video, we will explore the various aspects of PTSD, including its symptoms, impact, and effective techniques for managing and coping with it. If you or someone you know is struggling with PTSD, this guide will provide valuable insights and strategies for healing and recovery. Let's dive in. Understanding post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after experiencing a traumatic event. It manifests differently in individuals but often involves persistent feelings of fear, anxiety, and distress. PTSD is prevalent and can have a significant impact on mental health and daily functioning. It affects not only the individuals directly involved in the traumatic event but also their relationships and overall well-being. Common symptoms of PTSD include nightmares, flashbacks, avoidance of reminders, and hyperarousal. These symptoms can manifest physically, emotionally, and cognitively, making it essential to seek professional help and a formal diagnosis for proper management. Effective techniques for managing PTSD. When it comes to managing post-traumatic stress disorder, PTSD, there are several effective techniques that individuals can engage in. These techniques can help alleviate symptoms and promote overall well-being. Here are some evidence-based approaches. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a widely recognized and effective treatment for PTSD. It focuses on identifying and changing negative thought patterns and behaviors that contribute to the symptoms of PTSD. Through CBT, individuals can learn coping skills, relaxation techniques, and strategies to challenge distressing thoughts and manage their emotions more effectively. Eye movement desensitization and reprocessing, EMDR. EMDR is another evidence-based therapy that has been shown to be effective in treating PTSD. It involves using rapid eye movements or other forms of bilateral stimulation to help individuals process traumatic experiences and reduce the intensity of associated thoughts and emotions. EMDR can help individuals reprocess traumatic memories and develop more adaptive ways of thinking about them. Medication. In some cases, medication may be prescribed to help manage the symptoms of PTSD. Antidepressants and anti-anxiety medications are commonly used to reduce anxiety, depression, and insomnia associated with PTSD. It's important to work closely with a healthcare provider to find the right medication and dosage that works for an individual's specific needs. Relaxation techniques, mindfulness, and deep breathing exercises. Engaging in relaxation techniques, mindfulness practices, and deep breathing exercises can help individuals manage anxiety, reduce stress, and promote emotional regulation. These techniques can include progressive muscle relaxation, guided imagery, meditation, and yoga. Practicing these techniques regularly can provide individuals with effective tools for coping with PTSD symptoms. Physical activities and exercise. Physical activities and exercise have been shown to have significant benefits for individuals with PTSD. Engaging in regular exercise, whether it's walking, running, dancing, or any other physical activity, can help reduce symptoms of anxiety and depression. Exercise also releases endorphins, which are natural mood enhancers, promoting overall mental well-being. Coping strategies for dealing with trauma. When dealing with trauma and managing post-traumatic stress disorder, PTSD, it is crucial to have effective coping strategies in place. Here are some strategies that can help. Identifying and understanding triggers. Take note of situations or stimuli that tend to exacerbate your PTSD symptoms. By understanding your triggers, you can develop effective coping mechanisms. Building a support system. Surround yourself with caring and understanding individuals who can provide emotional support. Friends, family, and mental health professionals can offer guidance and a listening ear. Engaging in self-care activities. Make time for activities that promote emotional well-being and resilience. This can include hobbies you enjoy, practicing self-compassion, and taking care of your physical health. Exploring creative outlets. Engage in art therapy or journaling as a means of self-expression and healing. These outlets can help you process emotions and gain insight into your experiences. Remember, coping with trauma is a unique journey, and what works for one person may not work for another. It's essential to explore different strategies and find what resonates with you. Be patient with yourself and remember that healing takes time. The importance of trauma recovery. Understanding the long-term effects of unresolved trauma and the potential impact on various areas of life, including relationships and overall well-being. The role of trauma recovery in promoting healing, resilience, and improved quality of life. Seeking professional help and support to navigate the process of trauma recovery and address any underlying issues. The importance of self-compassion and patience in the journey of trauma recovery. Exploring different approaches to trauma therapy. When it comes to trauma therapy, there are various approaches that can be utilized to promote healing and recovery. Here are some of the different therapeutic approaches commonly used. Cognitive processing therapy, CPT. CPT is a type of therapy that focuses on helping individuals understand how their thoughts and beliefs about the traumatic event impact their emotions and behaviors. It aims to challenge and change unhelpful thought patterns associated with the trauma, promoting healthier coping strategies. Prolonged exposure therapy, PE. PE involves gradually exposing individuals to situations, memories, or objects related to the traumatic event in a safe and controlled manner. This exposure helps reduce distress and fear associated with these triggers, ultimately leading to decreased symptoms and improved functioning. Narrative exposure therapy, NET. NET is a therapeutic approach that involves sharing and processing the traumatic event through storytelling. It helps individuals integrate the traumatic experience into their life story, empowering them to create a coherent narrative and find meaning and resolution. It's important to note that each individual's experience of trauma is unique, and certain therapeutic approaches may be more effective for some individuals than others. A qualified and experienced therapist can help determine the most suitable approach for an individual's specific needs. Conclusion. In conclusion, managing post-traumatic stress disorder, PTSD, is crucial for overall mental health and well-being. Understanding the nature of PTSD and its impact on individuals is the first step towards effective management. Seeking professional help and a formal diagnosis is essential in developing a personalized treatment plan. Effective techniques such as cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and medication can significantly alleviate symptoms and promote healing. Coping strategies, building a support system, engaging in self-care activities, and exploring creative outlets are vital in dealing with trauma and promoting emotional well-being. Trauma recovery is a crucial part of the journey, and seeking professional help is essential in navigating the process and addressing underlying issues. Different approaches to trauma therapy, tailored to individual experiences, can provide immense benefits in healing and resilience. With patience, self-compassion, and the guidance of a qualified therapist, individuals can find healing and improved quality of life in their journey towards trauma recovery.